The other common complaint is about libido and sex drive. Libido is very complicated. It's not as easy as testosterone, as much as we'd like it to be. Testosterone can be very good, but there's many factors that make up libido, and these include things like the vaginal dryness. So if it hurts to have sex and you bleed when you have sex, you're not really going to want to have sex. If you've gained weight and or you're having hot sweats, you might not feel as attractive as you used to. So that might affect your libido. If you're having hot sweats and you're not sleeping and you're anxious and you've got a low mood, then that will affect your libido. The other thing is life events. So I quite often sort of ask my patients, is there anything else in the background going on with your life that you're struggling with? Because, for example, elderly parents who aren't very well, going to care homes, children who are leaving home, relationship problems, work problems, all these things as well impact the desire to have sex, or libido as we call it. And the other thing is, do you, as well as feeling attractive, are you attracted to your partner still? So there's lots of factors at play. And then obviously testosterone. Now, not every lady has a drop in their libido through the menopause, and that's because the body makes other types of testosterone, weaker testosterones from other places, such as the adrenal glands, which are little glands that sit on top of the kidneys. And for some women, that's okay, and that's called DHEA. But for other women, it's not quite enough. We replace estrogen and progesterone, but so why don't we replace testosterone? It's a key hormone made by the ovaries. I think the reason we don't jump straight in to replace testosterone is, for many women, they don't need it. There is this weaker hormone, DHEA, made by the adrenal glands, that for many women is enough for libido. And then also, many women get benefit from estrogen for their libido. So they start estrogen HRT, and then three months later, they feel better, their weight's coming down, they're not as sweaty. And actually, they say, actually, my libido is really good now, I don't need anything else. So we tend not to jump in with testosterone straight away. And the other reason for that is there are theoretically some risks with testosterone. If the levels creep outside of the female levels, you can get sort of beard hair, you can get an irreversible deepening of the voice, and you can get enlargement of the clitoris. So this is a sort of what people think of as a male hormone. So it has these sort of male changes. So whilst this is not common, and by keeping the doses at a sort of a sensible level and checking the hormone levels every few months, this doesn't tend to happen. But this is the reason we don't jump straight into it. And it's also not licensed in women in the UK. There are different ways to take it as well. So there's testosterone sachets, where you take a sort of pea-sized amount every day. There's Tostran gel, which is a bit stronger, so you use that every other day. There's an Australian one called Androfem, which again, it's just a topical cream. And then you've got the implants as well, the testosterone implants, which you can see a bit like grains of rice, and they just go under the skin every 6 months. It improves libido. Most people say it does improve libido, and maybe even things like drive and energy and sort of brain fog. But the evidence for those things is not quite as strong. But certainly people say it does benefit those as well. So as a combination with estrogen, progesterone, HRT, or just estrogen, it can be really effective for improving quality of life.